be advised, the opinions and views of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. This is your host for today, Dr. JONNA Cenica for What's Up, Doc?
I'm looking for someone when I'm sharing my happiness and forgetting my loneliness. Now that I found you, I will...
Good morning, everyone. And we're here again in What's Up, Doc? And before anything else, I would like to introduce my co-host for today, since my dad, Dr. John Cenica, isn't here. My co-host, Dr. Rayran Lau.
Good morning, Dr. Jonna Cenica, and good morning to all the televiewers of the GNN, Luzon, Visayas, Mindanao, and to our host, original host, Dr. John Cenica, who is watching right now. Good morning.
Okay, so for this morning, we have a very interesting topic once again because we are talking about deep scars, and we have a title which is also very interesting, I guess, for all the audiences out there. Our title is Bye Bye Deep Scars. So for this morning, mainly our topic is all about CO2 laser, am I right?
CO2 laser is for the, sinabi mo nga kanina,
Yes.
para maging bye-bye na yung mga deep scars.
Bye-bye deep scars
And
talaga.
we have here our two guests, two cosmetic surgeons
Yes.
specialized in laser cosmetic field. We have here Dr. Jessette Capuchino, Associate of Johnson Cosmetic Surgery and Fellow of the Philippine Academy of Non-Surgical Aesthetic. Good morning,
Hello,
Dr.
good morning.
And another guest, another Associate of Johnson Cosmetic Surgery, Fellow of Philippine Academy of Non-Surgical Aesthetics, Dr. LAURENCE.
Good morning, Philippines. Dr. Lau and Dr. Cenica. Good morning.
Okay, so for just to start with, what is CO2 laser?
Okay. CO2 laser to begin with is a type of laser where we use it as a type deep peel. Okay.
Deep peeling,
Wherein we use a radiation to target the specific areas of the face.
Okay.
Specifically yung areas na may scars,
Yung deep
acne scars.
Okay.
Yes.
Actually, itong laser na sinasabi nila, most of the time sa mga clinics, no? Pag pupunta, pag nakakarinig sila ng laser sa face, sinasabi nila, ano yun, Doc? Para saan yung laser? Actually, most of the patients hindi pa masyadong aware. No? So, this is the opportunity. Pag napanood nila itong segment na to, medyo alam na nila. Kasi sinasabi sa mga journals na it is the gold standard actually for skin rejuvenation right now. No? So, Dr. Jessette, ano yung mga usually na pumupunta sa clinic para magpa-laser?
Usually, ang mga pasyente natin, yung mga patients na may deep na pimple scars, yung mga
Deep
acne
pimple
scars.
scars,
So,
okay.
Tapos mga patients din natin na may mga fine lines and wrinkles. Tapos yung mga may stretch marks sa abdomen.
Stretch marks, okay.
Yan yung mga usual patients natin.
So, interesting kasi, matagal ng panahon na wala masyado talagang effective treatment sa stretch marks. Am I right?
Yes.
Hindi pa masyado talaga na bibigyan ng treatment tong mga deep scars na ito until CO2 laser came. Right? So, mainly, ang deep acne scars, talaga bang totally nawawala ito? Or medyo nilalighten lang ba niya? Or pinapababaw ba niya? Ano bang ginagawa talaga ng CO2
Pero before
laser?
that, ano muna ang cause? Bago sagutin yung tanong ni Doktora, ano muna yung cause ng mga pimple marks na sinasabi nilang baku-baku yung mukha? Ano ba
Parang
ang cause
craters.
Yes.
Sinasabi nila may mga craters sa mukha.
Okay, so, kasi when nagsisimula yan, may pimple ang isang tao.
Okay.
Then, syempre, hindi mapapakali. Normally, titirisin itatry tirisin or paputukin, ganyan. Eventually, nai-infect. So, instead of gumaling, the pimple, yung pores na yun, mas nababara because of the infection itself. So, lumalaki yung pimple na yun until a point na once nag-heal siya, nagkakaroon na ng mark. Okay? So, like ordinary scar, yung mark na yan, it's very hard simple, pag sinabi kasing scar, a scar is a scar na, di ba? No matter what we do. So, anong nangyayari, eventually, dadami yan, then the patient or client would continuously, seek for advice kung anong gagawin. So, ipiprick nila, they would apply any astringents, or to remove it or to dry it up.
Okay.
Pero eventually, nagkakaroon ng further infection or irritation dun sa pimple na yun. Kaya siya lumalaki, nagkakaroon ng pus formation, and mas lalalim siya.
Okay.
So, dapat pala, Doktora Cenica, no? Pag yung mga pasyente na nagkaka-pimples, wag nilang titirisin. Kasi minsan talaga may...
It's a no-no talaga, no?
Gustong-gusto nilang tirisin agad, no? So, ano pang ibang pwedeng gawin muna? Kunyari, nakakita kayo ng mga pasyente, nagtanong sa inyo mga pasyente na, Dok, may pimples ako, hindi ko na talaga kayang tiisin, gusto ko nang
Gusto ko nang tirisin to.
Oo, ano bang pwede natin gawin?
Normally, kung kunwari, may mga event common yan, may birthday party akong pupuntahan, Dok.
Tapos may nangangamatis
May
kang
pimple,
pimple, di ba?
So, what we could do as an emergency treatment,
Okay.
so we sometimes inject yung steroid or canalone. Minute amount lang, just to lessen the inflammation or yung pamumula na yun. Normally, the next day, magpa-flatten out na yan.
Pero sa clinic ito
Sa clinic
ginagawa,
lang,
di ba?
oo. Kasi yung iba, pag nag-self-medicate yan, sabihin, kaya ko na mag-inject, napasobra, mas nagiging scar din yun.
Right.
Mas
So,
malalim pa
Doktora
yung
Jet,
scar.
may mga pasyente ba kayo na nag-i-inject minsan ng sarili?
Talagang
Oo,
do it
meron
yourself
talagang mga
talaga.
pasyenteng gano'n kasi feeling nila madali lang. Pero actually, dapat doctor ang naglalagay.
Okay.
Kasi kapag napasobrahan mo yung lagay ng steroid, mas problema na naman yun kasi malalim yung scar na makakos nun.
Okay, there you go. Kailangan talaga sa doktor
Doktor
magpakonsulta. No?
talaga.
So,
Before we continue anything, you can send us your message at 0922-891-6761 if you have any questions about our topic for today. And please indicate your name and location. Again, 0922-891-6761.
and later on our second segment, Doktora Cenica,
Yes.
we will have a live demo. No, meron tayong 2 demo patients which ito yung papakita natin sa camera mamaya na meron silang mga scars, no? We have many types of scars, yung sinasabi nilang shallow base scars. Ito yung medyo nakalubog lang. May mga ice pick scars, yung may nakatusok. So yun yung papakita natin mamaya and i-demo natin for the laser mamaya.
You better stay tuned with us kasi mamaya makita niyo yung full demo and kung paano ito ginagawa, so you have an idea of how it is.
Okay. So, Doktora, we have a question from Justin Bibo. Is laser painful and how long is the healing time?
Okay.
Doktora Jet?
Like any other procedure, no, itong ating CO2 laser, medyo may mafe-feel na konting pain ang pasyente. Although ito, ginagamitan natin ng topical anesthesia, yung affected area. And then we wait for 30 minutes bago natin i-treat yung pasyente. May konti siyang pain na mararamdaman, although it's tolerable naman, no?
So may preparation pala talaga, may local
preparation yan.
anesthesia
Oo.
before.
And then after that, ang feeling ng pasyente is yung parang na-sunburn lang siya.
Okay.
So after the procedure, is it an outpatient or kailangan bang i-admit pa? Pwedeng sa clinic lang
Kailangan
gawin?
magstay ba sa clinic?
Pwede naman siyang umuwi kagad after. Ang precaution lang natin is, of course, wag muna magpapa-expose sa araw.
Oo.
Kasi it's a type of peeling on a deeper level lang. Pero pwede siyang umuwi the next day. Tapos, others go to work nga immediately after.
Right after?
Actually, yung mga
Okay.
yung type of patients na come to me, no?
Okay.
Sinasabi nila, Doktor, may downtime po ba yan? Sabi ko, yung may mga pasyente na walang downtime. For example, yung pasyente nagpa-treat, ang trabaho niya is call center, graveyard shift siya. So, hindi siya ma-expose sa sun. And sasabihin ko sa kanya, okay lang ba sa'yo na lumabas to go to work na meron kang sunburn? Sabi niya, okay lang po, Doktor. So, that's an example na walang downtime, no?
Okay.
So, after the laser, usually anong ginagawa niyo or ano binibigyan niyo advice sa mga pasyente natin?
First is yung, of course, the sun exposure, number 1. Kasi very sensitive pa sila niyan. Then, yung ako, I advise putting in mga post-healing cream or
Like?
repair cream, fast repair cream para mas mabilis yung healing time niya. Tapos, cleansing, after at least 8 hours ako, pinapa-cleanse ko na.
We have another question from Annalyn Tagyam from Santa Cruz, Manila. Doctor, what's the best remedy for skin peeling which is painless and could also whiten skin?
Okay?
Meron bang ganun? Painless skin peeling with whitening.
Painless skin peeling.
Okay.
Okay, with whitening. The best remedy dyan, actually ako, kung ayaw nila yung pain na medyo tolerable, I give in a milder form of chemical peel. Like yung mga glycolic or salicylic acid.
So there are many types talaga ng peeling. No?
Marami
Merong
talaga,
mild,
yeah.
for,
You have
moderate, and
choices,
severe.
diba?
Yes,
You
you
have
have
a
choices.
variety.
And that's depend dun sa severity ng mga pigmentation nila.
Oh, okay.
So, ang peeling ba ay nakakaputi? Kasi misnomer yan minsan sa mga pasyente na pumupunta sa clinic na sinasabi nila, gusto ko magpa-peel dahil gusto ko
Kasi
magpaputi.
oo.
Ano
Yan,
bang
exactly.
tamang advice natin sa mga pasyente?
Actually, yung peeling kasi, for example, superficial peeling yung binibigay mo sa pasyente, it removes yung superficial, yung dead skin, yung epidermis ng nire-renew niya yung first na layer ng skin mo. So, of course, nakakaputi yon.
So, ano bang mas maganda para sa inyong experience? No? For example, gusto mong magpaputi ng mga pasyente, what do you recommend?
In terms of whitening, ako, combination pa rin eh. Pero, mas iba pa rin ang bleaching eh. When I say bleaching, I apply at type of cream. Depende sa formulation, may alpha-arbutin, licorice, or even hydroquinone. Tapos, the peeling is secondary na lang. After kung i-bleach ng konti, ipipeel off ko siya para pantay. Lalo na yung mga sun-exposed area.
Right.
Let's say, sa arms. Normally, mas maitim yung upper part kaysa sa ilalim kasi yun yung exposed. Yun yung pinipeel ko para pantay siya.
So, there you go. So, hope na nasagot natin, Annalyn. So, yung chemical peel is para pumantay yung mga unevenness sa skin, no? The laser stimulates yung collagen inside para malinaw, para alam ng mga viewers natin. Dr. Cenica, we have
Another question from Jane David of Morong Rizal.
Okay. May scars po ako sa binti. Pwede po ba maalis ito? Before po, nagpa-laser na ako sa Taiwan, pero hindi nawala. And if ever, magkano po ba?
Yun ang laging question.
Tanong. Sabi nga nito.
Magkano po ba?
Yes, very conscious ang Pilipino sa prices.
Well, binte. Una, what type of scar eh? Pangalawa, how big? Kasi honestly, sa legs, to be fair with, mahirap talaga ang mga scar sa paa. Theoretically, sinasabi, because of the blood supply, medyo mas lesser daw, ganyan. Siguro ang best dyan is we start with the basic. Balik tayo sa basic. Chemical peel muna. So, superficial hanggang palalim tayo ng palalim. Until saka tayo magle-laser. Kasi yung laser, it somehow, it will produce as type of scar na medyo maliit naman, na mag-peel off din siya. Pero at least mas safer tayo na hindi natin ma-aggravate further yung scar.
Actually, ang mga scars talaga, it's very hard to treat, no? May ginagawang revise ng surgery, kaso hindi masyadong promising kasi medyo nag-widen din ng eventually yung scar nila. And then kapag tinitreat natin, may tinatawag tayong individuality. Pwedeng sa'yo mag-respond, pwedeng sa akin hindi mag-respond. No? So, depende talaga. So, mas maganda siguro magpa-consult talaga muna sa mga specialista.
Iba-iba rin kasi ang klase ng scars. Pwedeng ang isang scar is very superficial lang, di ba? And there are other scars that are really very deep. So, I guess sa ganong klaseng mga scars, they are really different or there's a variety of treatments.
Yes, and one of the goals kapag may scar ka sa extremities or sa legs is para hindi na lang maging halata. Kasi we all know na ang scars is hindi na talaga mawawala yan eh. I don't believe, personally, I don't believe sa mga creams na pinapahid na mawawala doon yung scars.
Na talagang totally 100%
Yes, ang pinaka-goal na lang natin is pag tinignan ka, hindi halata.
Parang ipapantay mo na lang siya dun sa skin tone ng patient.
Another question, bumubuhos ang question natin. Yung basta skin talaga and scars,
From
no?
Pangasinan to, ha?
Jomari from Pangasinan. What are the aftercare treatments for laser therapy?
Actually, nasabi ko na kanina, I'll say it again. Ako, I give a fast skin repair type of cream or a post-healing cream. Binibigyan ko siya, which is composed of mainly a small amount of collagen and different ingredients, wherein it stimulates collagen formation under the skin. Sabi nga ni Dr. Lau kanina, laser stimulate collagen production. So, yun. And sunblock, of course, usually 24 hours after the treatment. Importante.
So, ayan, you mentioned about sunblock. Marami kasi lumalabas na yung mga SPF. So, what's the minimum after the laser treatment, yung SPF na kailangan nila gamitin and how often?
Okay. For the SPF, depende sa lifestyle eh. If, kunwari, nagpa-laser tapos madalas nasa field, I would recommend SPF 80.
Okay, SPF 80.
80. Pero pag, let's say, office work lang, SPF 50 would be good.
How often?
How
Yung
often
ideal?
would be normally 30 minutes before going out. Then, if lalabas ulit or magta-travel, magtatagalan outside the or sa field, I would suggest every 4 hours.
Every 4 hours. Okay. Another question from Ronan Chu. Yung scar ko po sa tip of the nose, it's very deep kasi inopera. Collagen filler po ba or laser ang dapat?
Pwede yun sa CO2 laser natin.
Pwede, okay. Kasi deep scar din
Ito
ito,
kasing
no?
patient, hindi natin alam kung anong klaseng opera ang ginawa dito, no? So, yung collagen na sinasabi niya, siguro mas maganda magpa-consulta po sa clinic para ma-assess talaga na maigi, no?
Right.
Okay. Remember, after this segment is meron tayong live demo,
Yes,
no? Okay.
live demo.
And yung mga text nyo and questions, you can still text to us. And we're happy to answer all of that. Okay. Doktora, sinasabi nila na ang laser daw is nakaka-cause ng mga irritations, ganyan.
Nakakasunog ng
Nakakasunog. So, ano dapat yung i-advise natin? Ito naman, kanina kasi yung after, no? Ito, kunyari, gusto kong magpa-laser sa clinic. Sasabi, anong mga preparations ko muna bago
before ako pumunta dun sa clinic.
Yes.
Usually, yung mga patients natin, ina-assess muna natin, no? Bawal yung patient na kagagamit lang ng mga retinoic acid or mga glycolic acid pill. Bawal yun.
creams
Oo, na hindi mo pwedeng i-laser agad yun pag pumunta sila sa clinic.
So, gaano katagal nilang i-stop yun?
Usually, ina-advise namin at least 1 to 2 weeks.
1 to 2
Oo,
weeks.
before
Okay,
natin
very
i-laser.
common questions yung mga tinatanong ng mga pasyente. Lalo na yung mga babae, no? Sabi nila, how soon can they do the makeups after the CO2? Siyempre, ang mga babae hindi makakalabas ng walang makeup. So, how soon?
Actually, magpipil kasi yung patients natin, siguro mga 5 to 7 days tapos na ang peeling nila. So, after that, pwede na silang maglagay ng makeup.
So, around 5 to 7 days, pwede na. Okay, last question before our break. From Lizelle from Dagupan. Wow, talagang mga text questions natin. Doc, meron po akong scar galing po sa pagka-discussion ng 13 years old ako. Mawawala po ba ito pag nagpa-laser?
Okay.
Again, another scar.
Pagka-disgrasya,
Since 13 years old, so medyo matagal na talaga tong scar na to.
well, sa scar, what we could do is, like, always say, a scar is a scar na, di ba? First, we need to assess it. Tapos, we need to check talaga kung what other treatment methods. Like, there is surgical, there is laser, there is peeling lang, ordinary chemical. So, wide variety or we could do combination. So,
Right.
maganda pa rin talaga, we have to see it.
Consultation. Right. Okay. So, again, please tune in because after our break, we're gonna have a live demo for our CO2 laser. We have 2 subjects. So, do you have any messages before our break?
Okay, so lahat ng mga questions nyo regarding, o kahit hindi lang sa mga lasers, basta pagdating sa pagpapaganda, you could text or you could ask our 2 guests,
text in your
our 2 cosmetic surgeons, and they're happy to answer all of your questions. No? Okay. So mamaya, we have 2 patients, and ano bang mga preparations muna natin before tayo mag-break?
For the preparation, of course, we have to cleanse it.
Okay.
Minsan, ako sa clinic ko, I do a facial, a traditional facial lang. Then, after that, I apply a topical anesthesia. Then, I wait for around 30 minutes to 40 minutes. Then, I do a testing after that ng laser na. Then, tatanungin ko kung for the client, the pain is tolerable or masyadong parang burning na yung feeling. Ganun.
Okay. So again, please stay tuned and we will have a break. After that, watch our live demo.
There's a tear in your eyes, I know. I can feel that it's not been dried out all these years. Where were you when I'm looking for someone? When I'm sharing my happiness.
Again, welcome to What's Up, Doc. And as promised, now we have a live demonstration of what we have been talking about this morning, our CO2 fractional laser therapy. And as of now, we have our subject right here. He's a 28-year-old, a nursing student from Fatima University, Mr. Ebert Bulaod. Good morning.
Kinakabahan ka ba ngayon, Albert? Hindi naman. Okay, and I'd like to introduce our nurse from the head nurse of Janssen Cosmetic Surgery, Miss Hershey Recalde. To assist the doctors. Okay, so right now, we're gonna do the demo. So, Dr. Jet, ano yung mga preparations na kailangan natin, no? Baka isipin ng mga pasyente, ano ba yung hawak mo?
Bale ito, yung CO2 laser natin to.
So, that's the
ito
machine.
Yung machine.
Okay.
Okay.
Tapos itong ginawa natin kay Bert, nilagyan natin siya, itong mga puti-puti, this is the topical anesthesia.
Okay, so no need for sedation talaga, no? Topical anesthesia lang.
How many minutes before the procedure kailangan ilagay natin yung ano?
30 minutes before the procedure, nilagay na ito kanina pa, no?
Okay, so this is actually 30 to 40 minutes now, which is good lang, no? Mas maganda siguro na hindi less than 30 minutes and sakto lang sa 30 to 40 minutes,
Para
no?
talagang effective
Okay.
natin local
So,
anesthetic. Okay.
Doktora, napansin ko meron din tayong takip sa mata, no? What's the purpose of that?
Kailangan, no, before nag-start tayo, ilalagay natin yung sa eyepiece para protective gear yun para sa mata.
Okay, sige. So, siguro, tatanggalin natin yung
Start na
anesthesia
tayo.
para makita natin, no? Okay. So, Dr. Cenica, meron tayong question from Mrs. Cruz of Marikina.
Yes, habang tinatanggal natin ng kanyang anesthesia. Okay, I just want to know if the laser is also applicable
dito na lang
for
tayo, dito lang muna
sunspots
sa
or dark spots on my face. Generally, how much is the cost per session and where is your clinic?
Bert, start
Okay,
na tayo,
Dr.
ha?
Tan.
Dr. Tan.
From Marikina. Taga dyan ako eh. Well, CO2 laser is pwede naman kasi magpipil din naman siya pero it's not the number one treatment. Ika nga. We could do a semi-laser which is yung dinidiscuss before dito. I think it's IPL. Yun.
Okay, IPL is another machine naman yun, no? To
it's a
treat yung mga
different,
sunspots.
It's
Okay.
a semi-laser siya. Pero it's, CO2 would be pwede pero hindi siya ganun.
Okay, how much is the cost naman per session?
Na
Or,
For
around,
the-
or at least the range. The range man.
the range is around 10 to 15,000 for
Per
the
session.
for the CO2.
For the CO2 laser.
Yes,
And where is our clinic? Siguro, specify na lang natin.
Okay, my clinic is located sa Concepcion, Bayanan Avenue. It's right beside St. Vincent Hospital.
Okay, and of course, Janssen Cosmetic Surgery, we have 5 branches, no? Okay, right now, si Dr. Capuchino is doing the actual demo of the CO2 laser, no? Okay.
So, tanungin natin ang ating subject. How does it feel? Okay lang ba? Meron bang masakit? Is it painful? Is it like, how is it?
Okay lang.
Walang
Okay, so tolerable, no?
tolerable.
Okay. So, Dr. Jet, pag pumunta yung pasyente, tatanungin, gaano katagal yung procedure? For example, medyo nagmamadali, no? Gaano katagal yung procedure?
Yung procedure mismo is sandali lang, no? 20 to 30 minutes. Kaya lang nagiging 1 hour kasi yung preparation pa yung paglalagay ng anesthesia.
So, they need to budget their time siguro, mga 1 to 2 hours siguro,
mga
no? Pag
ganun lang
magpapatreat
siya.
sila sa clinic. Okay, we have another texter from Mirna of Laguna.
Doc, ask ko lang po kung mawawala ba sa laser ang melasma?
Okay, melasma, this is the mask of pregnancy.
Yes.
And then, na-aggravate to due to sun exposure, no? Siguro, Dr. Tan, paano mang...
Yes, like we said kanina, the CO2 laser is effective pero it's not the primary.
Okay.
We could use another form of laser for it, for the melasma.
So, it's the intense pulse light na
Intense
tinatawag
pulse
natin
light.
kanina. Okay. We have another texter from Corazon Manzano. May mga anak ako na may pimple scar sa pisngi. Paano ba ma-prevent ang pagsulpot ng mga pimples?
Prevention naman.
Naman ito.
Prevention,
Siguro nasa teenage tong anak siguro ni Ma'am Corazon, no?
Okay. For the prevention, actually, we could even
Sir,
use
ito
CO2 laser for
Okay.
prevention.
So,
Yes.
tanong ko lang, what's the age limit, minimum age limit and the maximum age limit na pwede magpa-CO2 laser ang mga pasyente?
Okay. For the CO2 laser, siguro the minimum age that we could have is, actually, it varies Pero it depends for the client kung kaya niyang sumusunod na siya sa instruction ng doktor na stable siya pag nakahiga and could tolerate a minimum amount of pain, pwede yan. For the maximum age naman, kasi we also use CO2 laser for rejuvenation di
Okay.
ba? So, pwede rin, depende
Okay, so sa mga below 18 years old, sa Dr. Cenica, kailangan may consent.
May
Number
consent,
one, may
oo.
consent ng parents, no? So we have another texter, Ayala Alabang.
Ayala Alabang, Susan Abrasado. Is laser a safe procedure? And where is your clinic?
Okay, Dr. Capuchino,
Doktora
tanong ni
Capuchino.
Miss Abrasado,
Safe
safe
ba
ba daw
daw ba
ang
ito?
laser?
Safe yung laser, basta ang gagawa dapat yung trained na cosmetic surgeon.
Okay, and then, so nakita nyo, nagpalagay si doktora ng eyepiece. It's to prevent, baka mamaya tumama yung laser sa mata, no? So it's very, very important na pupunta kayo sa clinic na sanay gumawa ng mga laser, no? Because these types of laser, pag napunta sa mata, baka it can cause damage, no?
Right,
Okay,
right.
so another texters from Bulacan.
Lisa from Bulacan. Doc, pag nagpa-laser po ba ako, ilang weeks ang paggaling nito? Or yung,
Okay.
I guess, yung recovery or
Yes,
yung
the recovery period.
downtime? Doc Lawrence?
The downtime is, according to Doktora, is 5 to 7 days. But in some patient, after 3 days, nagpipeel off na So, it varies talaga per individual. Pero it
Iba-iba
would,
rin, no?
yes,
Iba-iba
it would be nice if we give it at least 1 week recovery period.
You mean after 1 week, they could immediately go to work?
Yes.
Put makeup on and like nothing
Yes.
happened?
Actually, after 3 days, ako advice, after 3 days, they may put a light makeup.
Light makeup
Light
only,
lang,
okay.
oo. Kasi, dried up na yung yung scar, if meron ng konti,
Okay ka lang.
yun.
How about scrubs? Pwede na ba sila mag-scrubs after a week? Right
After a week,
ng
ako I would suggest na wag na sila mag-scrub.
Wag na.
Kasi nag-laser na
Right.
So magpipil din naman, no?
magpipil na, oo.
So, ma'am, kanina fino-focus natin yung mukha ni Albert, no? And nakikita natin, ito yung in-explain natin, Dr. Cenica, at nila Dr. Tan kanina, ito yung may mga shallow base scars. Ito, halo-halo yung scars ni Albert, no? Mukhang inipon talaga ni Albert. Okay, para sulit sa laser. Okay, itong ginagawa ni Dr. Capuchino is, once the laser hits the skin, ini-stimulate po niya natin yung collagen. And we all know na yung collagen ang responsible for skin tightening, for better skin rejuvenation ng mukha. So ito yung purpose or principle na ginagawa natin ngayon, no? Okay, we have another texter from Butuan naman, no?
Wow, Jem from Butuan. May black spots in my face and hands. Ano po dapat ang i-apply ko? So, more of chemicals naman ang
Black
tinatanong.
spots.
Okay, black spots, Dr. Tan, ano
Black
bang
spots.
masasabi mo dito sa mga black spots? Siguro ito yung mga pwedeng warts to, pwedeng mga hyperpigmented due to mga
Sunspot, freckles.
using mga matatapang na mga astringents. So, anong pwede natin gawin dyan, Dr. Tan?
Well, for the black spots, okay, sa face, they could, first of all, pwede start tayo dyan, chemical muna.
Okay.
Chemical peel. Then, enhance sa kamay, siguro we could also assess kung ano yung nasa kamay, especially.
Oo, okay.
If hands, ang sinasabi niya talaga.
Siguro, mas maganda talaga magpa-check up sa mga doctors, no? Okay, we have another texters, Gail of Pampanga. Doc, nagpa-laser na ako ng 3 beses pero di pa rin nawala ang marks ng pimples ko. Pwede po ba ulitin? Nag-worry na po kasi ako. Okay, sa mga ganitong pasyente na 3 lasers na actually wala namang numbers of treatment para limitations. Actually, kung happy na ang patients after 1 to 3 sessions, then we could stop.
Okay.
Pero kung nyari gusto pa ng pasyente na magkaroon ng improvement, then we could continue the procedure, no? Okay.
Just a question, kailangan ba mag-fully heal muna from the first laser treatment before you go into the second? Or is there a time, an interval na kailangan ganito before the second
Okay,
treatment?
that's a good question. Maganda after a month. Once
After a month,
Oo,
okay.
kasi
Once a month,
once
okay.
a month. Kasi we want to give time for the skin to stimulate or produce or to gather new collagen
Right.
sa space.
So, siguro maraming mga pasyente na ng mga nagpapa-facial, diamond peel. So, how soon after doing this laser treatment
Okay.
na pwede sila magpa-facial or diamond peel?
Iba kasi talagang lifestyle na nilang
Oo, minsan atap agad after 3 days, gusto nila agad magpa-diamond peel. So, how soon, Dr. Dan?
For the facial, I would suggest after 2 weeks.
Okay.
If sasamahan nila ng diamond peel, okay, let's say, nagpa-CO2 sila last month and happy na sila sa result, the month after, pwede naman sila magpa-diamond peel as a maintenance na.
Okay, so we have another test. Tanong ko lang po, anong remedy na hindi surgery na pwede magtanggal ng scar? Okay, siguro na-explain ni Dr. Tan kanina yan, no? Na ang scar is a scar na talaga. What we can do is yung peeling na ina-explain ni Dr. Tan para i-conceal lang, para hindi masyadong halata. Yun yung goal natin, no? And of course, the laser. Okay?
Although kung halimbawa superficial lang yung scar, can it be totally removed? Or kumbaga, totally lightened na talagang hindi mo siya mahalata kung medyo superficial lang?
Kung medyo superficial, hindi pa rin eh. Maski gaano kababaw.
Concealed pa rin.
Concealed pa rin.
Concealed pa rin. Instead of totally removed. Okay. From Jake Gamba of Iloilo, wow. Doc, ang laser po ba ay pwede sa kahit anong scar tulad ng keloid?
Sa keloid, it's a different, normally surgical na kami.
Surgical.
Oo. Kasi ang keloid is an expanding or hyperactive scar yan eh.
Okay. Kamustahin natin si Albert. Albert, kamusta?
Nakakatawa pa
Ayos
si
lang.
Albert.
Okay.
Nakakatawa.
Napansin ko kanina na Dr. Cappuccino, no, na laser pati yung nose. No? So, for example, gawa yung nose ng patient, no?
Nose lifted.
Na nose lifted. Okay lang ba silang magpa-CO2 laser?
Okay lang naman.
Contraindicated ba yan?
Contraindicated ba ang nose lifted sa mga magpapa-CO2 lasers?
Hindi naman.
Okay, so hindi naman. Kasi maraming pasyente na pupunta sa clinic,
Mga
nagtatanong na,
gawa
Dok, baka matamaan daw yung ano. So, hindi siya
Baka
contraindication.
mag-react?
Yes, so hindi siya, as long as siguro may time na nag-healed na talaga yung nose niya, to do the CO2 lasers para pwede na. Okay?
Darwin of QC, pag nagpa-laser CO2 ba ako, continuous po ba ito? Siguro kung forever,
Oo.
lifetime na ano na ba to?
No, hindi siya continuous. Actually, pwede, yung sa iba kasi, other clinic would give a facial rejuvenation using laser.
Okay.
Okay, so, if the budget allows it,
Okay.
pwede, pero hindi yung different setting, kumbaga. Mas superficial siya, tapos ang purpose lang niya is to rejuvenate the skin. Kasi, baka isipin din ng audience natin na for scar lang ang CO2. We could also use it for facial regeneration or facial rejuvenation.
Okay.
Yan.
Okay, so maraming uses, no? Facial rejuvenation, pimple scars, yung ginagawa ni Dr. Cappuccino ngayon, scars sa mga
So,
legs, and stretch marks
Hindi
actually.
lang pala siya bye-bye deep scars.
Hindi lang,
no?
oo.
Pati superficial scars.
Actually, you can do the laser
Kasama.
kahit yung mga walang pimple marks.
Oo, pwede.
For example, yung mga late 40s.
Pang-rejuvenate lang?
Yes, na gustong mag-reduce yung mga fine lines nila sa face, pwede natin gamitin tong CO2 laser.
Even yung mga may malalaking pores,
Oh,
pwede yan.
talaga?
Oo.
Pampa-minimize. ng pores.
Pampa-minimize ng pores.
Janice from Pangasinan. Tanong ko lang po kung ilang days makikita ang result kapag nagpa-CO2 laser.
Okay, Dr. Cappuccino, ilang days daw makikita ang result after niyang magpa-CO2? For example, si Albert, how many days niya makikita yung result ng CO2 laser niya?
As I've said, 5 to 7 days tapos na mag-peel off yung ibang patient. So makikita na nila yung immediate result.
After
noon.
mga 7
Oo.
days.
5 to
Okay. So maganda ang effect niya, no? 7 days. And with the CO2 laser, continuous yung regeneration ng collagen, no? So hindi lang after 7 days, actually after 2 weeks, 3 weeks, even after a month, nagre-remodel pa yung collagen. So nag-e-effect
Right,
pa yung trinit natin, okay? So we have another tester. Doc, mga ilang session po para mawala ng husto yung mga acne scars at magkano lahat po yung magagastos? Okay, dito sa clinic natin, Dr. Tan, no, sinasabi natin lagi, hindi kami nagbibigay kung ilang session.
Okay.
Sinasabi lang natin na on the first session, usually ang magiging improvement is 30 to 40%. So imagine that,
Okay.
30 to 40% improvement on your face. So medyo
Malaki na yun.
drastic yun, no?
Tsaka iba-iba rin kasi ang pagre-react ng mga patients
Yes.
sa CO2 laser, di ba? Pwedeng, like, etong isang person na to, 30% lang, pwedeng itong person na to, 40, 20%
Yes, may
lang,
individuality
diba?
na tinatawag, no? Okay, we have another texter, Dr. Cenica.
Yes. Renz from Pampanga, meron akong maliit na nonal or mole sa ilong na tinanggal through cautery machine 10 years ago. Pangit siyang tignan at nag-iwan ito ng malalim na butas or scar. Ano pang kubang procedure ang pwede kong gawin dito?
Okay. Ito, nagpa-cautery. Siguro malalim yung mole nito, no?
Malaki
Hinabol.
at malalim, oo. Well, we could check if gaano kalaki
Okay.
in terms of diameter. Pangalawa, there are two things that we could do. We could do CO2 laser or kung upon check-up,
Kaya pa,
malaki nga siya, we could do fillers naman.
Fillers na.
Fillers.
Okay. Siguro yung fillers sa next na topic natin, no? Kasi marami nagtatanong
Kailangan
regarding
yata
sa
may part 2 to.
sa
Ang daming
fillers.
texters
Okay, ang
eh.
daming texters, but we could accommodate konting-konti lang, no? Okay. Albert, kamusta?
Ayos lang.
Ayos lang.
Okay na okay ka pa dyan?
Ayos pa.
So after that, Dr. Cappuccino, ano yung ina-advise natin sa pasyente?
Immediately after ng treatment niya, nagbibigay tayo ng ice pack
Ice
to
pack?
relieve
Ice
the
pack.
pain, saka
Okay.
some discomfort.
To counteract lang
Oo,
yung heat. Okay.
oo.
Pag-uwi ba, meron pa rin siyang pain na mararamdaman? Does he need medications or anything?
After 1 to 2 hours, meron pa siyang swelling sa face, mamumula pa siya.
May sting pa ng
Oo.
konti ito. Okay.
Tapos we give him take-home meds na yung pampahid niyang cream.
Oh, okay, cream.
Okay, siguro yung mga cream, prophylaxis lang to avoid yung mga swelling, no? Okay.
Last question.
Okay.
Ang dami
Sige.
kasi nating texters. Okay. Sunshine from Antipolo, ang dami kong scars sa legs. Again, scars ulit. Anong remedy? Kung marami siya, siguro I guess, yung parang may mga...
Feeling ko, patsa-patsa yan
Oo,
eh.
patsa-patsa sa legs.
Siguro yung mga ganyan scars, kung patsa-patsa na naiitim, it's better to use chemical peel
Chemical peel.
Yes.
Rather than
rather than this.
CO2. Okay.
Okay, napakadaming questions. But kahit tapos na yung show, you could still text us.
Yes.
And we will answer your question through text messages na po, no? Okay.
Okay. So, Dr. Cappuccino, where can they find you? Saan sila pwedeng magpa-laser sa'yo? CO2 laser sa'yo?
Sa Johnson Midland Plaza Hotel. That's in Adriatico Street, Manila, beside Robinson's Ermita.
Okay. So, Doktora Jessette Cappuccino, thank you. And
Thank you
Dr.
so
Tan,
much.
thank you. May mga babatiin ka ba, Doktora Jonna? Bago tayo magtapos?
I just want to greet my dad. Hi, Dad.
Okay. Hi to Dr. Cenica.
Hello,
Thank you
Dad.
for
I know
allowing
you're
us.
watching.
Yes.
Dr. Lawrence Tan, where can they see you?
I am every Monday I am at Scout Borromeo, Johnson
Okay.
Scout Borromeo,
Okay.
and every Wednesday, Friday, and Saturday in Johnson Ermita, at Adriatico, and every Tuesday and Thursday, I'm at Marikina at my personal clinic near St. Vincent at Bayan-Bayanan Avenue.
Okay. Dr. Cappuccino, any final words for our televiewers?
About our CO2.
Okay. For those patients with problems sa mga pimple scars, lalo na yung mga malalalim, also patients with fine lines, saka yung may mga hyperpigmented skin, we can do CO2 laser sa kanila. So just visit at any Janssen branch.
Dr. Rayran, where can they find you?
Okay, I'm always at all the branches of the Janssen Cosmetic Surgery. In Davao, in August 18, I'll be going to Davao. Yes. You could see me there and free consultation po pag nakita niyo po ako doon.
Yes. Kaya tandaan niyo yung face ni Dr. Rayran.
Saan sa Davao?
Nails Avenue and Medispa in front of Royal Mandaya Hotel.
Okay. So, it was a really nice...
Yes.
Yes, so ito
Really
talaga
nice
bye-bye.
episode
Kay
for
Albert
us.
is bye-bye deep scars na talaga.
Oo.
Kay Albert,
Sana makita
thank you
natin
so
siya
much.
sa next episode. Tingnan natin yung
Pag
yung
nag-heal
results
na siya.
sa kanya. Pwede. Okay. So, again, thank you so much everyone for tuning in with us. And again, I hope you enjoyed our episode for today. I hope merong part 2,
Kasi
doctors.
isa lang yung ginawa
Yes.
natin
Kasi ang
kanina.
dami-dami nating texters. So anyway, it was nice being with you guys again. And thank you to our subject. Thank you, Miss Hershey. And again, you're watching. And please tune in next week, Saturday. And we have a replays on Sundays. And this is Dr. JONNA Cenica and my co-host.
Dr. Raylan Lau for
You're watching What's
What's
Up,
Up, Doc?
Doc? Thank you, guys.